Hi, I did my presentation and my research question on the COVID-19 vaccine effectiveness. I made a questionnaire and collected data and presented it into a slide deck. So what was my research question? The research question is, what is the opinion of college-aged people about the effectiveness of the COVID-19 vaccine? And my goals for this study was to learn how people in this age group feel about the vaccine. I thought this was going to be interesting to compare how I personally feel compared to others my age. And I also want to compare people's opinions based on their demographics and try to understand people's reasonings behind their opinion. So some background information on the vaccine. The Pfizer and BioNTech was the first COVID-19 vaccine approved by the Food and the Drug Administration, which is the FDA. It issued first emergency use authorization on December 11th, 2020. This allowed the Pfizer and BioNTech to be administered in the United States. This is recommended to be given to people 16 and up. Right now they are looking to approve it to be given to children ages 12 to 15, but they're waiting for that approval, and this shot is recommended to be given in 2 doses about 21 days apart. After the emergency use authorization of the Pfizer and BioNTech, 2 more vaccines so far have been authorized by the FDA. So the Moderna vaccine was authorized on December 18th, 2020. It's supposed to be given to individuals 18 plus with a recommendation of waiting about 28 days between each dose. And also the Janssen vaccine, better known as the Johnson & Johnson, was authorized on February 27th, 2021. There was a brief pause on the Janssen vaccine just because a small number of people who have received the vaccine did end up getting blood clots, but after a couple days on the pause, they brought the vaccine back, and now it's available for the United States. My method of study, my study instrument was a questionnaire, and I used Google Forms. I found it really easy to collect data and also just make the questionnaire through Google Forms. And my justification was this study was done just because the COVID-19 vaccine is a very relevant topic, and it's going to continue to be very relevant for a while. It's a big debate between a lot of people. So this is one of my first question. I asked the gender of my respondents. So I had 37 total respondents. I had females, males, and a non-binary respondent. Most of my respondents were females, 78.4%, 18.9% were males, and 1 non-binary at 2.7%. And all of my respondents were college-aged. So my procedure for this questionnaire was respondents answered 3 multiple-choice questions, 1 scale question, and an open-ended question. So I collected the data and turned it into 4 different pie charts and then a word cloud. This is another pie chart I made based on results. So each respondent I had was 18 and up, but not every respondent was enrolled in college yet, so this is just based on what they answered. So 35.1% was the biggest group in the College of Education, Health, and Human Services. Next to that was the College of Arts, Humanities, and Social Sciences, where 24.3% of my respondents studied in. College of Mathematics and Sciences, where 18.9% of my respondents. College of Graduate and Continuing Education 2.7%, and then 18.9% of my respondents weren't enrolled in college. So this is another pie chart. My question was, do you personally worry that the COVID-19 vaccine will have long-lasting side effects? The majority of people said they weren't worried about the long-lasting side effects at 56.8%. 13.5% of my respondents did say yes, they were worried. 27% said they weren't really sure. They would want to do more research before picking a side of yes or no. And then 1 respondent wrote their own answer in saying they were a little bit worried just because they're only into a year into the pandemic and the vaccine hasn't been out for too long. And my next question was, do you believe enough time was given to develop, test, and produce the COVID-19 vaccine safely and effectively? So I had 27% as my biggest response, along with 27% of neutral. So 27% of respondents strongly agreed that enough time was given, and 27% were neutral about it. 24.3% of respondents said they agreed with that. 16.2% disagreed, and 5.4% strongly disagrees. So based on that, more respondents were on the agree side of the scale for deciding if there was enough time to be giving the vaccine, which I thought was interesting. This was my word cloud I made, and I based it on the question, if you haven't already, do you plan on getting the COVID-19 vaccine when it becomes available to you? If not, please explain. So as you can see here, the biggest answer I got was yes. I did get some no's, I did get waitings. A lot of people said they were getting it soon, or has already got first dose, or received both doses. Some people planned on getting it, possibly, waiting to see for dangers, I don't trust it, and then a lot of the reasons why people want to get it, which I was glad they wrote it in. Someone said they want things to go back to normal. Someone said to protect others. Someone said because it's effective. So I did more research into the demographics of it, and 28 female respondents said they already have or will get the vaccine, while 2 male respondents said they already have or will get the vaccine. 1 non-binary respondent said they have already or will get the vaccine. Only 1 female respondent said they won't get it. It's a definite no. 2 male respondents are waiting for more time just to see if there's any side effects. 2 respondents said possibly they'll get the vaccine of males, and 1 male respondent said no, they will not be getting the vaccine. So overall, it seemed that most respondents in my study felt the vaccine is both safe and effective. I found these very interesting, all this findings I've done, just because gender seemed to play a huge role in the results. As you could see, males did seem to be less trusting of the vaccine, while females seemed to trust it much more, and many more females than males in my respondents have already been vaccinated. So if I were to do this future work, I think I'd change my field of study question into like a political affiliation question, because I think I'd be able to compare demographics differently that way, and I think it would give a different insight on things. And I think I'd also ask respondents their opinion on the idea of requiring the vaccine for colleges, just because we have been seeing that a lot of schools are requiring it for the fall, especially Westfield State. So I would ask and see how they feel about that, especially because people that are against it, I don't know what their plan would be for next year. The overall conclusion of my study is that I found that most people who are college age already have got the vaccine or are planning to get it. It was very interesting to compare results to the respondents' demographics, and I definitely found that the gender and field of study seemed to impact the results. And then those are my sources.